I assume we are good. I'll roll with
Yep.
it. Namaste and a very warm welcome to everyone to our Policy Cafe on Ending Hunger Together from Episodic Relief to Systemic Resilience. Before moving forward with today's program, I would like to introduce myself. My name is Madhav Durpa. I'm a supply chain executive and startup investor with over 25 years of experience. Beyond that, I have significant nonprofit leadership experience taking on societal challenges such as food insecurity, access to education, and healthcare access. I also recently served as the president of Sewa International's Atlanta chapter. Today, we are delighted to have several distinguished panelists with us, joining us from all over the USA. We are also privileged to be joined today by members of Sewa International leadership team, whose guidance and commitment shape so much of the work Sewa does. By the way, we are also live streaming this discussion today on YouTube as well. Being involved with Sewa for over 5 years, I feel especially grateful for this opportunity to be here today with you all to facilitate the conversation of such a relevant topic in our present time. We are also honored to have our president of Sewa International USA, Mr. Shrikant Gundavarpu. Shrikantji is a leader with deep commitment to strengthening our collective service. He's an accomplished Indian American entrepreneur based in Atlanta who previously led the Atlanta chapter and played a pivotal role in Seva's COVID-19 relief operations. Above all, he's an awesome friend and a wonderful human being. So please join me in welcoming Shrikant Gundavarapuji. Shrikantji, it would be good if you can give us a quick overview of Sewa International and Sewa International's impact work as well.
Thank you, Madhavji, and namaste and warm greetings to all of you. It is my absolute privilege and honor to share a few words about Sewa International. We are a volunteer-led humanitarian nonprofit rooted in the timeless ethos of selfless service, or Sewa, as it is called in Sanskrit. Here in the US, Sewa was founded in 2003 as part of a global movement that began in India in 1989 and now spans more than 30 countries. In the US, Sewa has grown to 46 chapters, powered by more than 11,000 volunteers. Together, we have touched close to 900,000 lives, built over 130 partnerships, and committed nearly 100,000 hours of service. Our work ranges from disaster rescue and long-term rehab to youth engagement through our LEAD program and another program called After School, and also vital family services and significantly hunger relief efforts that have become a cornerstone of our community service. Seva's hunger relief work has grown from a small youth-led effort into a nationwide movement. It began in South Jersey in 2018 with about 17 volunteers collecting about 2,200 pounds of food, and now it is called Sewa Diwali, which since its inception has mobilized about 700 plus partners across 38 states, resulting in awesome 2.9 million pounds of food donated nationwide. This impact continues across the regions. In Tampa, Sewa distributed about more than 1,600 pounds of food, providing 1,400 meals to Feeding Tampa Bay. In Houston, Sewa supported indigenous communities by donating 500 plus pounds of food to Native American partners. During Hurricane Beryl, Seva's disaster response delivered 1,500 hot meals, supporting 150 students, and coordinating the distribution of over 10,000 pounds of food across Elif and Fort Bend areas. Through ongoing spring and Diwali food drives, more than 5,500 pounds of food were donated and served in 2025 alone. Across all these efforts, Sewa serves some of the most vulnerable populations, low-income families, seniors, children, and disaster-affected communities, combining immediate food relief with long-term community resilience. This policy cafe aims to reimagine hunger not as a symptom of poverty, but as a solvable governance challenge that can be addressed through shared data, decentralized networks, and innovative funding infrastructure. Today, I look forward to hearing from each of the panel members and learn from you as well. And our panelists, will share some stories, and we will learn. And together we'll get better and do better. Thank you very much, Madhavji.
Thank you, Srikanji, for sharing very impressive scale and impact of Sewa International's work. And it's especially specific to today's topic about hunger. Um, so, with no further delay, it's my privilege to introduce today's panelists who will guide us through a thoughtful and enriching conversation. So, in no particular order, I would like to first invite Dr. Steven Sazima. Dr. Steven Sazima is an agricultural economist and postdoctoral researcher at the University of Vermont. His work focuses on food procurement, food security, and diet quality, with recent research on home and wide food systems in New England. He's a recipient of 2025 Heading South Award from AAEA and AARES, and he has published in leading journals, including Food Policy and the Journal of Rural Studies. His research examines how social, economic, and institutional factors influence the transformation of food systems. Thank you, Stevens, for joining us today. Next up, we have with us is Cindy Baggett. Cindy Baggett is the Vice President of Development and Marketing at Feeding the Gulf Coast, where she leads fundraising, advocacy, and community engagement across a 24-county region spanning South Alabama, South Mississippi, and Florida Panhandle. Since joining in 2017, she has strengthened cross-sector related partnerships and advanced community-centered strategies that move beyond short-term relief towards long-term food security and resilience. Thank you, Cindy, for joining us. Now, allow me to welcome Scott Brummel. Scott is the Assistant Director for Food and Nutrition Security at Duke University's Office of Community Health, where he leads cross-sector partnerships to strengthen local food systems and health access in Durham. He co-stewards Duke's Root Causes Fresh Produce program, a food as a medicine initiative supporting patients facing food insecurity, and contributes to equity-focused policy efforts through local commissions. His work is informed by experience with global institutions and a master's degree in bioethics and science policy from Duke. Welcome, Scott, and thank you so much for joining us today. Next, I would like to invite Becca Clausen. Becca is the president and CEO of Second Harvest Food Bank of East Central Indiana. She brings extensive experience across church ministry and nonprofit leadership, having served in roles spanning fundraising, program management, case management, and executive leadership. Her work across multiple US states has focused on advocating collaborative, community-driven solutions to food insecurity, poverty, and economic self-sufficiency. Welcome, Becca, and thank you so much for joining us today. Next up, I would like to welcome Jada here. Jada serves as Chief Resource Officer at Midwest Food Bank, where she oversees people and revenue resources supporting the organization's mission. With 7 years at MFB, Midwest Food Bank, she works closely across teams to empower staff, volunteers, and sustaining funding efforts. She brings over 2 decades of experience in sales and marketing at Caterpillar, along with a background in agricultural engineering from Purdue University, shaping her practical and solutions-driven approach to nonprofit leadership. Next, we have with us is Sakina Shabazz. By the way, thank you, Jada, for joining us too. So, about Sakina Shabazz. Sakina is a mid-career policy professional based in Washington, D.C. She has held director level and advisory roles in state, federal, and national nonprofit institutions focused on food, agriculture, and nutrition. With a background in public service through AmeriCorps, her work centers on expanding food access through partnerships, research, public education, and storytelling. And she's currently a fellow in the Congressional Hunger Center's Legacy Leaders Program, focused on executive leadership for social change. Thank you, Sakina, so much for being here with us today. Of course, last but not the least, we have our panel moderator, that is Raki Israni. Raki Israni serves as the Vice President of Marketing and Public Relations at Sewa International. Raki ji leads our strategic engagement with nonprofits, policymakers, and public institutions. Raki is an attorney and an entrepreneur based in California and a passionate advocate for civic leadership. She brings deep experience in law, policy, and nonprofit leadership to this conversation, and we are honored to have her moderate today's panel. Welcome, Raki ji. It's all yours now.
Thank you. Thank you, Madhavji, and thank you all for joining. I think before we begin, I feel like we need to kind of ground this discussion in some reality. Hunger in America is not an abstract problem. I think everyone here is actively involved in that. It's really a moral contradiction. And the statistics are pretty stark. In 2003, nearly 18 million households, representing 47.4 million people, experienced food insecurity. For us, these numbers are not just USDA data. They are the mother quietly asking for extra school meals, or the senior choosing medicine over groceries, or the children who rely on community events for their one hot meal. When hunger touches 1 in 7 families in this country, it stops being a statistic and it becomes a national failure. And the paradox is clear. We live in a land of overflowing supermarket shelves, yet nearly 1 in 5 children still goes to bed hungry. And the burden is profoundly unequal. Black and Latino families face hunger at more than twice the rate of white households. And the issue is not a lack of food. America produces enough to support the entire population. The gaps are systemic. They lie in the planning, the infrastructure, and the delivery systems that connect food to people. When the pandemic era benefits ended, food insecurity surged to its highest level in a decade, showing that while food programs are lifelines, they may be too rigid for moments of crisis. And we've also, I think, witnessed extraordinary community resilience, from food rescues and mobile markets to disaster relief, where organizations like Sewa and their volunteers and other organizations provided thousands of hot meals. These acts prove that solutions exist in our neighborhoods. We need to simply connect, strengthen, and scale them. Ending hunger, it requires a dual approach. Deep community empowerment and thoughtful systemic reform. So our objectives are really threefold today. One is exploring how to make federal programs more responsive to the real life needs of families. 2, learn from grassroots, self-sustaining, hunger-free ecosystems run by nonprofit and faith communities. And 3, ensure that lessons from the community inform policy and that policy empowers local action rather than constraining it. And that's why we've convened this National Policy Cafe on Hunger. And with this background, I really look forward to hearing from all our panelists as we move forward into this discussion. So, I think just to kind of start off, what we thought was we'd start with kind of introductory statements from each of our panelists to kind of inform what their experiences are and what their perspectives. And then we'll go into the discussion part of this. And at any point, if anybody has any thoughts they wanted to comment on something someone else's, you're definitely welcome. But we'll start, Gina, if it's okay, we'll start with you. You've done a lot of great work on the ground in the Midwest at the Midwest Food Bank. If you could tell us a little bit about the unexpected lessons that you've learned through that work.
Sure. First of all, thank you for the opportunity to be here. As you said, it is a moral tragedy, and what we find is that there is hope in the hardships. There is hope, and we, as a food bank, provide food to 2,400 nonprofits. So 2,400 nonprofits receive food from Midwest Food Bank. and those are in 25 states. And we are just encouraged by the community, like you said, the grassroots programs, those nonprofits providing support and energy and love to those that are in need, as you said, the 1 in 7 households across our country.
Awesome. And did you want to, are there any unexpected lessons or any lessons that maybe you've learned that you wanted to share with us?
Yeah, thank you for that. Like in terms of a lesson learned, there is not, first of all, hunger and food insecurity is not um, there's not a single cause. And if there was one single cause, it would be easier to solve. But what we find is that holistic support. So whether that's financial literacy, whether that's job training, whether that's medical, providing medical support, addiction support, like the grassroots community-based solutions help address poverty. We've also found that poverty is both a cause, excuse me, hunger is both a cause and an outcome of poverty. And it's a bit of a self-fulfilling prophecy, right? Like if you are facing food insecurity, there might be other challenges that are going to lead to poverty, and then that continues that cycle of hunger. And so the kind of the lessons that we have learned is being able to support those nonprofit organizations that are providing that holistic support, and that gives hope. And what we've also found is that many of those nonprofits that we're providing food to are faith-based organizations, bringing the community together. Sometimes we're overwhelmed, whether it's from a church basement or from a faith-based nonprofit, how the community is being supported by these nonprofits.
Awesome. Thanks, Jada. And you're absolutely right. There's a book by Michael Harrington, The Other America, where he talks exactly like that. Poverty is just a vicious cycle. The poor get sick, they lose wages, it leads to lack of resources, and the whole thing. And that's what exacerbates a lot of these problems. So you're absolutely right. There's many facets to this problem, and hopefully we can kind of talk through some of them today. So Becca, I know you're also on the ground in the Indiana area. If you could tell us a little bit about what you've learned, how some of the strategies that you guys have used to achieve long-term food security, that would be helpful.
Sure. And thank you. I'm pleased to be here, and I appreciate the opportunity to share. We're a much smaller food bank than Midwest Food Bank, but what we see 8 counties. And, there are several things that we've learned just about food insecurity in general, and that is to listen to the neighbors who are experiencing it. There's a saying about nothing about me without me. And so having the opportunity to listen to our neighbors, to find out what they need, as well as how we can help the best, as opposed to just making that decision without them, that's a huge lesson we've learned. But one of the things that I'm really proud about at our food bank is that we have this sort of tagline, Help for Today and Hope for Tomorrow. So we have a couple of programs in Hope for Tomorrow. And those particular programs, one of which is called Forward Steps, and then the particular curriculum we use is called Getting Ahead in a Just Getting By World. We have graduated 29 classes so far of folks who 15 to 20 folks at a time who are very, very interested in figuring out what it takes to get from where they are to where they want to be. So it's a program that's very little about food and a whole lot about life and how we can make a difference. A lot of food insecurity has a whole lot to do with wages, low wages, the gap in wages. Most all of the folks, and I think all the folks that are in food banking will attest to the fact that we're seeing folks in lines that have 2 and 3 jobs, and they can't get food because, they can't, food is the last thing on the list just because they have to pay their bills and do other things with their compensation. So our Getting Ahead class really helps understand the difference between what it takes to live in poverty and what it takes not to live in poverty. And for some who are in generational poverty, that is a huge hill to climb. For those that are in situational poverty, honestly, we found them helping each other. Because if you're in situational poverty and you've actually not been in poverty at some point, you can help those who are in generational poverty kind of toe the line up the hill. And it is a beautiful thing to see those classes and how they come together and how they help each other and how they help each other with resources, and then how they become advocates in the community. We have seen many go on to really make a difference and be that voice that we need in the community. So that's one of the things we're doing, and we're very proud of it. And it's a big thing for a little food bank, but we really believe in it, and we believe that it's important.
Well, that's awesome, Becca. I mean, that's you're absolutely. We have to just find this little bit of catalyst that can, take people out of this whole vicious cycle that otherwise, if you're alone, is really hard to break out of. So thank you for sharing that with us. That Hope for Today, Hope for Tomorrow is it's a very inspirational tagline. So Cindy, I know you're doing it on the Gulf Coast. If you want to share some of the work that's happening there, especially the patterns that you see in hunger deficiencies among different lines.
Yes, thank you. So I am joining you from Alabama. Feeding the Gulf Coast serves 24 counties. It's a 22,000 square mile service area. Of course, we work with partners, as was mentioned by my sister food bank staff there. We have partners across those communities who are really our boots on the ground. And from our frontline work, what we see are clear patterns in hunger deficiencies that show up across racial and ethnic communities, across the areas that we serve. We serve some of the least resourced states in the nation, with Mississippi and Alabama being so high on all of those lists that you don't want to be at the top of. The patterns that we see are shaped less by individual circumstances and more by systemic poverty and the longstanding challenges that affect access to nutritious food that you touched on. In so many of these under-resourced neighborhoods, families face limited or non-existent access to fresh food, to reliable grocery store options. In so many of the rural communities of color that we serve, the deficiencies look different because there are long distances to grocery stores, limited transportation, and fewer access points for nutrition and support programs. These patterns really reflect the imbalance in the systems that surround these families, and absolutely not a lack of resilience, but these barriers that exist within the communities. Across both urban and rural settings, hunger shows up in households long before it shows up in the data. Families stretch meals, reduce food quality, and rely on higher cost, lower nutrient options because they don't have access to those healthier food options. So that limited access and those barriers make it harder to maintain consistent nutrition. What we see is that recognizing these patterns and addressing them head on is essential to building the systems that can support long-term stability and health. We focus a lot on food as medicine, nutrition education, resources, and really meeting people where they are to increase access to this healthy food and to the resources that are so critical in overcoming these challenges.
That's wonderful, and in fact, actually, that's a good next segue into to work that Stevens is doing, because he's looking at a lot of the alternate ways of generating food, especially I guess in rural areas. So Stevens, why don't we turn to you? How do you, in your opinion, based on your research, how do we strengthen the strategies to address food security, especially given some of the stuff that has already been talked about in terms of long stretches between meals or the distance traveled for food, things like that?
Yeah, thank you, Raki, for introducing me, and I want to take some time to congratulate and thank the other panelists for all the work they are doing. They are leading or working in organizations that are in the front line, helping people. I hope one day my research will be as helpful as their work. And so I am currently, and this is, I'm going to speak from this perspective because I'm not I don't want to talk about all the research I'm doing. Currently, I'm working on food security, diet quality, uh, regional self-sufficiency, and also climate resilience, especially as they relate to participation in home and wide food procurement in New England, uh, especially in the two most rural states in the US, that are Vermont and Maine. So it's quite an interesting setting to study such question because rural areas face unique challenges when households are trying to meet their food needs. And these are things we can talk about later. Just to be sure that we are talking about the same thing, and mostly for other people, because we all know what food security means and food insecurity. But as a reminder, when we're talking about food insecurity, we're talking not, the USDA defines food insecurity as the limited and uncertain access to adequate, safe, and nutritious food. I'd like to underline that it's not just the lack of access, but also even the uncertainty surrounding access to food. If you're not sure what you're going to eat tonight, this is also part of the problem. And hunger obviously is an experience you can feel as food secure, as being food secure, but food insecurity is also linked to so many other dimensions, as Jada mentioned earlier. So it's not something, it's really, there are many dimensions to this, like it's linked to health and diets and even economic participation, because food insecure people may be less productive than someone who has access to food. So, that's for the basics of the thing. And now we have also to acknowledge that food insecurity, not all food insecure people experience food insecurity the same way. For example, we know that low-income households are more affected than other households, and also the prevalence of food insecurity in rural areas is higher than the national average. So why is it like that? There may be many explanations, but I wanted to highlight, and I don't want to take too much time. These are things we can talk about later. But what is interesting when talking about this is that even people benefiting from, let's say, food assistance programs can still experience challenges to meet their food needs because, for example, people on SNAP, even if you're on SNAP, there is, for example, what economists call the monthly SNAP cycle, which is in the first 2 weeks after receiving the benefits, you spend much of it, and at in the later weeks, you may experience lower dietary quality and even food insecurity while you're waiting for your next payments. So this means that even if you have access to or you're enrolled in such program, you may still face various challenges. And if you're living in a food desert, let's say, regardless the programs you have access to, these are structural challenges that no food access in itself can change. And if the area you're living in, there are not enough food options, or only a few retailers holding market power and that are able to control price and even impose higher prices, these are things that going to stay, in the area, no matter what you have access to. So you're I would end with this. While talking about food insecurity, we must realize that it's not just a money thing. It's not just about having enough money. Also, all this geographic and even I didn't even mention the cultural aspects of discrimination, stigma, and all that people can that marginalized people can face. So yeah, it's not just about money, and maybe it is why we still have this issue in even the wealthiest nations.
It's really interesting. And I think, Stephen, as you highlighted, and it's already been kind of highlighted, there's so many facets to this. I mean, there's an education aspect to it. There's the socioeconomic stuff, the cultural stuff, and actually figuring out how do we dissect a lot of this stuff is itself a challenge. And I think, Scott, I wanted to kind of turn to you next, because I think you have done a lot of work linking food access to health outcomes. What are some of the early signs of hunger symptoms that you've seen in neighborhoods before they actually appear in data that can help govern a lot of these discussions?
Sure. Yeah, thank you for the opportunity to share some perspective here. And I think before I answer your question, I think just, another thing that I think about with food security work is, in coming to it from the perspective of food as medicine, and also from the perspective of students that are interested in learning about medicine and wanting food as medicine to be a part of their training and a part of how they practice medicine. It's been really great to think about the healing aspect of food as much for the folks who we are working to provide that food to, as it is healthy and healthful for the folks who get to be involved in this work. And I think we all, as much as we may have bags under our eyes and lost sleep, I think in our own ways have found ways that this work has been very meaningful and very soothing to ourselves. And it's been great to kind of come to this work with that perspective, to invite more people to be a part of this work with us, to share more of their perspective and bring more of their talent to this work. Because there's so much work to be done and so many perspectives to have with it. And to the question of ways that we're detecting some of these needs, I'll share one perspective that we're really excited about here at Duke. And we approach food through this lens of how can it heal, but we also get to use the lens of our academic and research perspective. And a technical lens that we are working on developing here is leveraging a lot of the lessons learned during the pandemic about population health and working with our municipal governments to be able to take there's a project happening right here at Duke and in Durham where we're working to take wastewater samples. And we have a microbiome researcher at Duke that has the ability to take samples from our wastewater and detect the DNA, the plant and animal DNA that's being consumed by our communities. And this is a very technical and very nascent way of answering your question, but it is a perspective that we're trying to bring of, how can we be using our different strengths to get ahead of some of these challenges in ways that are, easier and less invasive and allow us to be able to move resources in different ways ahead of time. So that's one example where we're kind of developing and refining the technology to allow cities to, in very concrete ways, see, in the aggregate, what is the nutrition of their community. And part of the reason why this is really exciting is that the tools that we have in food security work to understand what the needs are and what people are actually consuming are pretty limited. And it's limited also by this understanding that we don't want to get too involved in the lives of the people that we're working with it, and we don't want to create more struggle with survey fatigue. And granted, wastewater sampling can feel kind of invasive, but it's another tension that we're trying to work out to see, are there, creative ways that we can be thinking about these problems and engaging different sectors of academia and research to get involved in this work. So that's one example.
That's awesome. And I think that, is a good segue into, what's happening at the federal and state level to not only detect a lot of this stuff as it maybe becomes a bigger and bigger problem, but also some of the work that's being done on the ground, that they can at least have those indicators to nip some of that stuff in the bud. And so this is a good segue into the work that Sakina is doing on the policy side. So Sakina, from the policy experience that you have, what are some of the on-the-ground signs that show where the U.S. food system is really failing to prevent hunger, given all the stuff that's going on and the resources that we possibly have at our disposal to figure some of this stuff out?
Rocky, thank you so much for that question. And it's really good to be in the company of you all for this particular policy cafe. In terms of where the U.S. food system is failing to prevent hunger and where that shows up in our communities, I think everyone on this call would be able to speak to that question, but I'll tap into just a few examples. I think when the government was recently shut down, when our world and our community shut down in response to COVID, we see these instances where people are participating and frequenting food banks for the first time. We see the lines in the cars stretching around parking lots, down sidewalks, sometimes socially and spatially distanced to make sure that people are in safe contact with other patrons, and then also the staff and operators of food banks and food pantries. And so when you visually see those cues where people are sometimes seeking out that kind of assistance for the first time, or maybe frequenting those establishments more often because of their economic insecurity and food insecurity status, that really is an indicator that something is wrong, that some amount of need is not being met at the household level. Similarly, I spent a year or so doing SNAP outreach and working with a partner that was affiliated with the local human services agency here in Washington, D.C. Prior to the COVID-19 pandemic, the Department of Human Services in Washington, D.C. did not have an online SNAP application. So people had to physically go to their local social services agency to apply for SNAP benefits, to get a ticket at the counter from the clerk, wait to be called in, speak to an eligibility worker, and go through a screening process. There were different points at which those lines outside of the Human Services Agency were stretching down the block an hour or two before the agency was even scheduled to open. And so I think the standing in the line, whether you're seeking food assistance or seeking to apply for a benefit, really is some indication that need is not being filled. And I think just that visual aspect of it can be very stark. And then when you layer the weather on top of that, when conditions are cold, when conditions are rainy, when conditions are extremely hot, it can be a very, very difficult experience to manage individually. I always want to give kudos to the food banks and the food pantries that are thinking about the user experience of people who are coming to their food banks, spaces that have play areas for children, that make it feel like it's a grocery store where people have choice. That is so dignifying to the human experience that they're having to fill those needs. And then the last example that I want to point to is the grocery gap, or the lack of access to grocery stores. In some areas, there are stores, but they're not always stocked with the healthiest foods. In Washington, D.C. in particular, the organization DC Hunger Solutions produces a grocery gap analysis on an annual basis. And I just pulled a couple of statistics from that. In the District of Columbia, where I'm a resident and where I work, 9% of households are food insecure. I'm not talking about Congress. I'm not talking about the courts. I'm talking about regular people who have been in the District of Columbia for generations. 9% of households here are food insecure. DC is broken into a ward system, or a ward sort of segmentation for neighborhoods, and wards 1 through 6 are typically higher income. There are at least 6 grocery stores in each of those wards, and upwards of 13 in Ward 1 specifically. In wards 7 and 8, which are predominantly Black neighborhoods and areas in the District of Columbia, there are 4 grocery stores in Ward 7 and 3 grocery stores in Ward 8, where the average annual income is less than $50,000. So there are these different indicators that we can point to and think about that reflect where food insecurity and hunger might be persisting and a number of reasons why that might be. And those are some of the reasons that came to mind when considering this question.
Awesome. So I think, I appreciate all of your kind of opening statements, because I think it's given us a lot to discuss and a lot to kind of think about. I think that, there's so many different facets, but I feel, Sakin, I'm just going to just ask you one kind of follow-up question as we go into this discussion of health and education and, the distance between or the access to food and stuff like that. So more specifically on the policy side, right? Stevens had mentioned that that even when there are benefits, so one point is that the need is so high and not everyone's getting them, but the second point is that even if they get them, the delay or the use of those resources is actually not so efficient to begin with. So let me ask you on the policy side, specifically looking at things like the Farm Bill or the GFSA, and I think when you and I had spoken, you had mentioned a few other things that are coming. How do these things catalyze stronger local innovation to address hunger in a more effective manner than possibly is happening now?
That's a really great question on the federal policy landscape. I think if you are really working at any level of government, whether it's local, state, the federal policy landscape is influencing the work that is happening at the level that you are in. It's really rare that you are just completely isolated from the federal policy environment taking place here in Washington, D.C. Into the two pieces of legislation that you mentioned, the Farm Bill and the GFSA, or the Global Food Security Act, those two pieces of legislation really reflect the domestic landscape and the global landscape when it comes to thinking about food systems, food security, access to programs that support access to food, but also support food and farming systems. And so I'll just tackle the Farm Bill and then just say a little bit about the Global Food Security Act after that. The Farm Bill is a really, really important policy vehicle for shaping the American food system. The current Farm Bill in place is the Agricultural Improvement Act of 2018 that was passed almost 7 years ago, and it's intended to be reauthorized by Congress every 5 years. Congress has not fully reauthorized that particular piece of legislation. And we're talking about the Farm Bill because the Farm Bill authorizes SNAP, the food stamp program, as it was formerly called, under the nutrition title specifically. And so that federal policy landscape is important in that regard when we're talking about nutrition. And when thinking about the stronger local innovation connection, I was thinking about some examples about where we see that on the ground. We see SNAP being used in our communities at authorized retailers, grocery stores, farmers markets, corner stores, sometimes even the gas station, depending on where you are. But there are a lot of other interesting programs that are authorized under the Farm Bill that I know the folks on this call know about because of the work in food bank operations. So I'm thinking about TFAP, the Emergency Food Assistance Program. That's what gets American grown commodities into our larger food banks, and that get dispersed across our food bank networks down to food pantries, to churches, and other distribution points. We also have the food distribution program on Indian reservations, or what's called FDIPR. That program typically operates in place of SNAP because tribal nations across the United States and across with respect to their own tribal sovereignty typically don't operate the SNAP program due to a lack of access to grocery stores. And so in place of that, many of them operate FDIPR, Food Distribution Program on Indian Reservations. That program is also authorized through the Farm Bill. And back in 2013, there was some really, really innovative stuff happening with FDIPR specifically. They launched the bison pilot program. Bison is really, really important to different indigenous communities and as a source of food, and also as an animal that has a lot of cultural and traditional significance. And the food distribution program on Indian reservations had a pilot program where they were sourcing bison as a food option for distribution from tribal producers for tribal communities. That is really, really awesome local innovation that was happening at the ground that the U.S. Department of Agriculture administered and that the Farm Bill allowed through the 2018 Farm Bill. We also have our nutrition incentive programs. like GUSNIP. GUSNIP is the Gus Schumacher Nutrition Incentive Program. That's what allows SNAP participants to do their double up bucks at food markets. So if you go and you maybe use $20 in your SNAP benefits, when you get to the farmer's market, you might be able to match that dollar for dollar up to $20. So now you really have $40 that you can spend on fruits and vegetables. That's really good local innovative work that is consistent and is also shown to increase fruit and vegetable uptake, which is super important. The last thing I'll talk about is the Global Food Security Act, or the GFSA, on that global perspective. That is the bill that allows the Feed the Future program to operate. Feed the Future is a really important program that focuses on global food insecurity and really galvanizing the work to address that particular issue. And that particular bill authorizes the Feed the Future Innovation Labs. Those labs and research spaces are dedicated to addressing global food security in partnership with universities, both domestically and globally, to do that cross collaboration, to think about more nutrient dense food options that can be grown, to think about soil health and water quality, the different intersections between farming and food systems. And it just really reflects the best of that type of collaboration. And the way that that is brought home, those universities that they focus on are public institutions. We're talking about our land grant institutions, our minority serving institutions, and a lot of programs that are doing research in the public interest. So that's really how those federal dollars can flow down to the state level, to the local level, and really reflect innovations that address hunger and food insecurity.
It's pretty cool. So, especially the second innovation that you mentioned about, if I understood it correctly, that they're doubling the money if you pick more nutritious options, which is actually super interesting. Before we go to the health stuff, and before I turn it over to Scott, I just wanted, Stephen, your perspective on that, and more specifically from an economic lens. I mean, given those innovations and some of the things that are being looked at, do you see any type of reforms that would help stabilize food access, especially in rural and lower income regions?
Yes, thank you, Raki. I believe that I would start with highlighting what we already have. And I think Sakina has done a good job presenting the big picture of all the options we have under the current farm bill, excuse me. And maybe one other option that we could mention is that there's a policy allowing you to use SNAP benefits to purchase seeds and seedlings to start gardening, which is quite interesting. And this is one aspect I'm working on in my research, understanding how SNAP interacts with these other more non-market food sources. And current research I'm doing are quite promising. And because what this means is there is an incentive to in SNAP for people to start gardening and become more self-reliant. And this has potential to maybe release pressure on like financial pressure on SNAP, since people have other options to meet their food needs. And even if we cannot value these other non-market options, there are some economic estimation of what they were. For example, I know a research that has tried to measure what is the market value of foods people get from food pantries, and they estimated it to be like almost $30 billion. So these are also expenses the federal government doesn't have to make because others are doing it. And it's really interesting this way. And to answer the question about what reforms or directions we could go moving forward while acknowledging what is already being done. And by the way, there is another thing I would like to mention. For example, the Senior Farmers Market Nutrition Program, which is one that is dedicated to seniors, low-income seniors, and also have an incentive to purchase at farmers market, which is quite interesting. So given all that, I think that moving forward, it would be interesting to have more targeted and better interconnected policies, food policies. By more targeted, I mean like the example of the Senior Farmers Market Nutrition Program, designing or providing more options that acknowledge not all food insecure households experience food insecurity the same way. The challenges, let's say, seniors are facing are not the same as the youth or other segments of the population. So, and by interconnected policies, I mean policies, and I know there is already efforts to that has been done, like in food banks, pantries, to not only consider food access, but other dimensions. But there is still a lot of room to, let's say, integrate in policies, not only food access, but also nutrition interventions, and see how this could also be connected to the healthcare systems. I'm thinking about interventions like food as medicine, and this is challenging because we're also used to think in boxes, like, okay, food access in one box and nutrition in another, but we definitely need a more systems thinking to integrate this policy. This could be also helpful when the next crisis come, because when there is this kind of connection between actors fighting for insecurity, when there is a crisis, it's easier to bounce back because the channels connecting them already exist. And this is something that can be highly valuable, especially in times of crisis.
So I think it's really, as JD, you mentioned in the beginning, I mean, this is really bringing a lot of hope that there are things that are being tried to encourage healthy living, healthy eating as a step towards resolving hunger. And so this kind of brings in the US health systems and how much costs are related to when we try to solve hunger in a way that doesn't take into account nutrition. So Scott, let me turn to you. I mean, given some of these innovations and given what's happening, what are your thoughts on that connection? How do we get some of the local governments to adopt some of these innovations or initiatives? What are your thoughts?
Yeah, thanks. One thing that is resonating, Sakina had mentioned, some exciting things that were happening in 2018. And I think related to that, around that time with the Affordable Care Act, there were a number of programs that were being kind of spun up that over the last decade have sort of taken root, or at least have been able to be demonstrated briefly with some exciting results. One of the outcomes of the Affordable Care Act was something called the 1115 waiver that allowed states to apply for funding to pursue innovative programs for Medicaid patients. And in North Carolina, we adopted a program called the Healthy Opportunities Pilot that brought to our state $650 million, which was a mix of federal and state money. So there was a state required match for that. And that those dollars were under how North Carolina conceived of using this 1115 waiver created a pilot program where healthcare systems, in partnership with health service organizations or social service organizations or nonprofits, however you want to call them, um, were able to work together with compensation to provide for the health-related social needs of the patients that were being seen by these health systems. And those health-related social needs, by and large, over 80% of the services provided under the Healthy Opportunities Pilot were food-related. And what that meant was that patients, as they saw their physician or were involved in the healthcare system, could be referred and essentially prescribed by that healthcare system to receive insurance paid food deliveries as it relates to their healthcare and that relationship they have with that healthcare system. That was, I'm going to get the years wrong, but I am entering in the chat the interim summary report that has a lot of the more accurate details. But this was a program that went on for about 4 years, around 2021, and concluded this past summer. It was going to get renewed. Uh, Trump happened, and but we got some really exciting things out of those first 4 years, where we were able to provide these compensated services to nonprofits that were using food with the food banks of our area, and right now, the primary evaluation and the mode of looking at the effectiveness of this program was through Medicaid claims data. And what we saw that was really exciting in that realm was that patients that were receiving this service, and the state in large, we were seeing that patients were costing the healthcare system $85 less per month per patient. This program that was using, these insurance dollars to provide for these services was saving money. And it not only was providing these incredible benefits to the patients themselves, but it was also pouring money into kind of the food system and helping nonprofits build out their infrastructure and their capacity to work with local food suppliers and provide that to their patients while developing closer relationships with the healthcare system and kind of closing that loop from the conversation that the patient and the doctor are having about nutrition to the community around that patient that helps them get access to that food. And it's incredibly exciting. And we at Root Causes, which is the food program that is based out of our School of Medicine, we've been able to do a similar program. Our program itself was not included in the pilot, but we've been able to work with insurance companies to essentially model that same program. And by working as a part of the hospital system, not only are we looking at the claims data, but we also have connections to the EHRs for those patients, and are able to track and see healthcare changes from the medical records themselves. Compare that to cohorts of people who, for one reason or another, were not able to be a part of our program, and start to educate ourselves as a healthcare system of what is the benefit of this. And another kind of next phase of this that's really exciting is pairing working with our finance department as a health system to understand, not only are we seeing what the healthcare changes are for our patients, but what are the financial changes that we're seeing, either for the patient themselves or the payers that are helpful for their care. And this is all really exciting because it gets to this, intuition that we have that we are really doing something beneficial and smart, and that we, should have been doing a long time ago, but is incredibly difficult to track and understand the outcomes of this. Part of that's because of the culture of how we've approached this work through like a charity lens, is that we haven't really thought to evaluate all of these different outcomes. But as a health system, we're pursuing these ways not only to provide more evidence for this work that we all believe in, but we are also having to think of this prevention work as a strategy to help our hospital continue to provide good services and continue to work towards lowering the wait times in our emergency departments and help our health system continue to be as efficient as possible so that we can be treating, within the hospital or the doctor's office, the most critical needs of folks, while trying to mitigate, lesser needs with our partners and with the patients themselves out of the hospital and in the community. So those are some of the exciting things that we're doing, and we're trying to do it in a way that, we with the resources that we have, and that from dollars to people and the talent, working with community partners to pilot some of these ideas and share this with like our local food bank, we are demonstrating the ability to provide the service and look at the data through our, this one particular partner agency, but are doing that collaboratively and having our food bank at the table so they can see this and try to work with us to talk to the other partners that they work with and help think through how can we enable this same level of insight to more and more agencies. And that's also been really exciting and interesting to think through, just the partnerships and the relationship building across these different agencies. And, as we have this health lens on the food system, I can't help but think about the people that I work with here in Durham and what they look like and who they are and who I get to learn from. And it's people that have incredible experience, but, by and large in the kind of charity food system, it's a lot of folks who are, come from a faith-based perspective or are, it's not a lot of young people, to be honest, that are doing this kind of work. And that, we think about during the pandemic, we struggled from supply chain issues, and that really caused us to think about the resiliency and the brittleness of our food system. And that's caused us to look at the people that are doing the work as well. And and so there's going to be an evolution in the folks that are doing this work, and we're trying to think of ways to bring more people together so that we can still take the knowledge and the experience and the familiarity that some of these partners have been building over decades, but also pair that with the insight and the perspective that that we bring as an academic medical institution. And as a young person myself, getting involved in this work, I have the pleasure of, working with students and trying to help them see this as a very exciting and hopeful space to work in. Yeah, so that's thinking kind of holistically about the health of this work. I think there's a lot of exciting space to continue to do things.
Yeah, for sure. I mean, I think that as people start to understand that hunger cannot just be viewed in isolation, but there's a lot of implications and causes and all that need to be really kind of analyzed. And I think that's actually the fantastic thing about bringing this discussion together, because you have people on the ground that are seeing, this stuff in practice, as well as you're seeing the good intentions that go into policymaking or teaching people. And using data-driven processes to really try to solve this problem. And so this is kind of a good segue into what's happening on the ground. And so, Becca, why don't we start with you? Given some of these innovations and given the attempts to kind of teach people about nutrition, to look at some of the health markers, to show them that maybe there are benefits to actually taking care of your health through programs like this, or teaching them how to garden, let's say, for example, so they can sustain their own kind of existence in a more fruitful manner. What are your thoughts on like some of the federally funded nutrition programs currently, and what are the ways that they could be redesigned, and if so, how?
Sure. This was a great question, because I was thinking, boy, this is let me dream, dream what's possible. And there's two things here. There's if you're talking about how the federal programs that we sort of are a part of, how that would help with local food bank support. And then there's how the federal programs help the individual neighbor. So it's kind of two-pronged. You're either talking about how can it be redesigned to help the neighbor, and then you're talking about how can it be redesigned to help us help the neighbor. So it's two different kind of things. But as far as the food bank is concerned, dreamy, stabilize demand and supply, and maybe index it in some way so that we're not. The food bankers are known for being able to pivot, at a moment's notice, and so the whole idea of us not getting that whiplash effect, and that we could actually we could do something that was more localized in procurement. We didn't have to wait on a big load to come from a national manufacturer. And then doing that would help us with shortening supply chains and increasing freshness and keeping the dollars local. And all of that helps with economy, as well as the freshness of the food, of course, helps with nutrition. And, integrating health and nutrition into what is bought for us. And again, that's another one of those things like nothing about us without us. So of course, if we're involved in TFAP kind of food, we don't get any input into what gets bought. And so it's somebody else's idea of what we should be giving to other people. So, there is somebody on the federal level that's at the top of at least the Feeding America group that gets a little input, but it is not, it's still at the discretion of the USDA. And as we all know, different administrations have USDA folks who have different ideas. And so those different ideas don't always translate correctly. Well, I don't say correctly, but well. So there's those pieces. If there's some way to invest in logistics capacity so that we have a better way to hold on to food. There are different food banks have different capacities, and being able to do that would be extremely helpful. More is talking about, we did have a federal program that helped us work with farmers. So then that particular program went away, but really kind of prioritizing that farm to food bank kind of projects and being able to get food that comes directly from farmers, local farmers. And then if you're looking at the individual and how their particular federal programs would help, could be redesigned, is again thinking about how can they get things. I appreciate you pointing out, Stevens, that they can use their SNAP benefits for seeds. We teach local gardening here. We have a garden here as well as a greenhouse. And so that's important to us, especially in that program I talked about earlier. We make sure that the folks who are learning to sort of move out of their poverty situation also know how to plant food and get to it that way. We're also involved in food as medicine. So several people brought that up, and I think that's extremely important. And we have several food as medicine grants as well as food as medicine programs out there. But for the individual specifically, allowing choice and dignity is the be all end all, in my opinion. And I know that some people think if you allow choice, then they're going to choose bad foods, because that's a completely misnomer. And we have a specific school program where I can pretty much indicate that is untrue, because in that school program, it's all about choice, and the children get to come and choose food in a choice setting with their parents. And more often than not, they're not choosing the sugary cereals. Of course, we don't often send that out, but if that's the case, they're interested in the vegetables, and they're interested in the meat, and they're interested in, so when they're holding their parent's hand and they're going around and they're pointing, get that, it's very interesting to see what the choices end up being, especially even for young children. And so that is something I think that's very important. And I'm not necessarily for dictating to people who have SNAP what they can and can't purchase. I think that's not necessarily the way to go. And it doesn't really do anything but say, Big Brother's watching you. You can only eat what we tell you can. So with that in mind, there's lots of redesign possibilities out there, I think, for both the individual and the food bank. I could go on forever, but we're trying to change. We're in the systemic business. And so if there was a way to meet, we're looking to change that systemic vibe there. And so if there was a way to meet halfway, it surely would be helpful. But it doesn't always seem that that's where our government programs are headed. So anyway. Very good.
Well, it's actually really inspiring how much effort you guys are putting on the education side and teaching people about the alternatives. I think that's everything starts with education, I think, to begin with. And so
Absolutely.
it's very, very admirable. And maybe actually based on what you were saying earlier about the choices and the trans fat stuff that comes out, maybe that's where the education is needed, really. But so let me turn to Cindy. Cindy, and you had mentioned earlier about the distance and the lack of choices, especially for people in some of the least resources states and the rural demographics, I guess. So given some of the things that have been talked about, especially I think Stevens talked about the teaching people to garden or allowing them to buy seeds so they could they can solve some of these needs on their own. What are your thoughts on those programs and how they're being implemented and how they specifically affect the people that are in the Gulf Coast?
Well, I just have to say that I'm excited to hear about all of the innovative research and programming that's taking place. I think that conversations like this are so important to improving food insecurity. Just understanding that the coordinated efforts across all sectors is going to be what really leads us to the solutions that the communities need. And also that understanding that the people who we're serving, the families and individuals who are actually facing these challenges, should always be at the center of our work. I think that that's what is inspiring me about conversations just like this. I think that without collaboration and conversation and working together, the partnerships that are needed to really address the real issues, they can't happen. They won't develop. I think that we've talked so much about the nutrition programs, and it can't be overstated just how critical those programs are to the communities that we all are serving and that we all are focused on. Instability in policy, it creates instability in the family's home. The impact on household stability is immediate and can be devastating when there are disruptions like the recent SNAP disruption, as we all saw with the shutdown. So strengthening these programs and ensuring that local organizations can not only meet urgent needs, but that they can support long-term resilience is critical. I think that can't be, we can't overlook that. And I know that we're all on the same page about it, but it's just so important to everything that we're doing to create that resilience. We have to have the stability that the programs provide. There you go.
Awesome. No, thank you, Cindy. Yeah, that's great. And Jada, I wanted to talk to you about like some of the community-led initiatives, especially as we came off the COVID pandemic and we saw how that disrupted life everywhere in this country. What are some of the solutions that you think, given kind of the policy stuff, given the implications of a lot of this stuff, what are some of the community-led solutions, given the framework in which we live, that help us move beyond just emergency relief, food relief?
Yeah, thank you for that question. And I hit on this a little bit earlier, but I think the really recognizing that we want the families that we're serving to move beyond just the food, the emergency food assistance. And that transformation is going to happen in community. And so at Midwest Food Bank, our goal is to provide food to nonprofits at no cost. And so everything that we receive, we give it away at no cost. So then the nonprofits have more funds that they can then serve more holistically. So finding ways that we can be efficient so that we can give the food to the nonprofits so that they can therefore put their arms around and create community in their local environment and serve well. And so whether that is, again, like job readiness training, just even being a friend, right? I think in the recent SNAP pause, just being a reliable resource to help people feel comfortable coming to a food pantry and receiving that support. Someone earlier mentioned about the where we see spikes where people access emergency food systems for the first time, and just making sure that they're treated with dignity and choice, and how critical that is. Another example that I want to share that I think is a bit innovative is that we have recently partnered with our local healthcare system, and they are screening for food insecurity as one of their health indicators. And so as they screen their outpatient clients for food insecurity, we have worked it so that they have a steady supply of food that they can send. And we also have some variety of that food so that they have some choice of what food is being sent out. And it's sent out in a discreet bag, so it's done with dignity, so that we can just meet those patients right where they're at. And it's a very grassroots pilot, but just how can we dream about expanding something like that? So that in one community, we know that anyone who's going to the hospital, to the children's hospital at that, the families that are not able to provide for their children, they're able to go home with food. And we know that that's not long-term, that's not sustainable, but like in that moment, their need is being met.
That's awesome. I think the one thing that's kind of come out of here, like, especially Jada, Cindy, and Becca, hearing you talk about like some of the stuff on the ground, I think the bottom line is that we just need to listen to, to the people that are there, because I mean they know what they need, and they understand it, and I think that the health implications and all. I mean, everyone wants to be healthy, and ultimately, I think that's the goal. And I think that a lot of these initiatives kind of take us in that direction. So, there have been a lot of questions in the chat, and there's one that was put in the in actual chat, where it says, "Will the panel address the USDA's newly announced regenerative farming pilot program and how such initiatives can strengthen food security by restoring soil health and producing nutrient-rich food without reliance on toxic chemicals?" So Sakina, if you want to touch on that, and then we'll move into I've got some closing statements or closing questions for each of you. Go ahead, Sakina.
Yeah, I can address that just very quickly. That was announced, I want to say last Thursday, by the U.S. Department of Agriculture and also by the Department of Health and Human Services. It was a combined announcement from Secretary Rollins, who's over USDA, and Secretary RFK Jr., who's over HHS. And this particular pilot program is allocating $700 million from the USDA to focus on regenerative farming and other efforts that pertain, as is written here, soil health, and the ability to invest in farmers to produce nutrient-rich foods. It's actually pretty consistent with some of the other efforts that existed under the Biden-Harris administration, specifically the initiative around climate-smart agriculture, which looks at different mechanisms for growing food in the United States, but as the name alludes to, is climate smart. So there was a lot of emphasis on soil health. There was a lot of emphasis on water policy. There was a lot of emphasis on using reduced inputs or specifically synthetic inputs in growing, focusing on no-till or low-till, so you're not causing too much disruption to the soil, but also thinking about different specialty crops that can be grown as well for consumption. So that's like your apples, your fruits, your vegetables, things of that nature. This really does reflect the intersections of farming and agriculture and nutrition. This particular pilot program is going to be headed under the NRCS, or the Natural Resources Conservation Service, which has a lot of the programs that are focused on climate and conservation at the USDA. And I'll just say very quickly, prior to my role at Bread, I used to work at the USDA, but I was at the Food and Nutrition Service. But I was one of the leads over the local and regional food systems portfolio. So those are programs that were ran in conjunction with NRCS and also the Agricultural Marketing Service, which does all the buying for programs like TFAP and other food bank programs and the distribution program for Indian reservations. So I think it's just yet to be seen. It's a good thing. And it's good to see where some of their priorities are landing on that particular topic.
I think it's very inspiring, because I think everyone has good intentions. It's a question of bridging the gap between how it's being implemented on the ground and what the overall objectives are. And I think we're getting there. It's just a matter of each of us kind of having this conversation. So, as we move into the closing section of this, I think there's been a lot to the discussion, and I'll tell you that as we were even preparing for this policy cafe, we did one on education, we did one on nonprofit management, we had one recently on disaster relief, and I think that in my mind, having been involved in nonprofit for the last 3 decades, that I think those were easier for me to digest. Hunger is wide. It's so much. And I think this conversation has been very eye-opening. And so in the closing section, I do have kind of questions for each of you, but I just want to, I mean, feel free to kind of comment on anything that you've heard that you think could solve this problem in a way. And you can dream, Becca, you can totally dream as much as you want in this section of it. That would be great. And so Gina, why don't we start with you? The question I have for you is, but like I said, if you feel free to answer it as you wish, but if you could scale one community solution nationwide, what would it be?
Yeah. So one solution that we have that I think is helpful is that we have a very dedicated focus on a volunteer engagement. And so I think it was Scott earlier that said that much of this, emergency food system is with an older generation. And so we have empowered our volunteers to do some of our core work, whether that's managing our inventory, running our forklifts, driving our semis, being our bookkeepers, like really dedicated role, because what we find is that people want to make a difference. All of us are here and we're employed to do this work, but there is an army of individuals that really care and they're passionate about this. The folks that are listening right now are the ones that are passionate about this. And so employing volunteers to help with this work and channeling some of our early retirees that want to come and still serve and find purpose, allowing that to be part of our staffing resource. And therefore, we are doing our work more efficiently so that we can give more food away. And so this is food that we're trying to make affordable, trying to provide at access points where people are in need. So anything that we can do to make our services more efficient and lower cost, we want to do that. And so there are people who want to give back. And so finding ways for them to serve in meaningful, skill-based ways. Now, obviously, as we mentioned, we are in an aging population. And so how do we continually recruit younger individuals, and finding the next generation that wants to serve is part of our opportunity to make that a sustainable solution for our operations.
Yeah, and I think as Scott you had made that point earlier as well, is getting some of the younger generation to really understand the impact that could be made and the resources that could be used to understand really what this problem is definitely the need of the hour. So Cindy, why don't we turn to you on what do you think is going to define the next generation of hunger relief organizations?
So I think a lot of the conversations that we're having today are really going to be part of that. The next generation of hunger relief organizations will be shaped by how well we can strengthen and integrate the impactful work that we're already doing, pairing immediate food access with the strategies that support long-term stability and resilience. Hunger relief doesn't always require innovation, right? I mean, the model has been successful. However, there's so many impactful, collaborative, innovative research projects and initiatives that are happening now that really can just deepen our alignment and create stronger partnerships and a clearer path for families to access the supports that already exist. As I said, the model has come so far. We've built on approaches that meet the urgent nutrition needs. We are connecting people to benefits. We're working alongside and within health systems to just really ensure that people have the nutritious food and access to it that they need, even directly from the doctor's office through those prescriptive boxes that we know are so meaningful. Engaging in policy conversations and supporting those community-led solutions where we do have the people that we're serving, the families that we're serving at the center of all those solutions. I think that what's going to really define the next generation is how these efforts continue to be refined and to evolve and ensure that the families who are experiencing hunger are connected to a network of support rather than a series of isolated efforts. The next generation of organization is going to use data better to understand patterns and inform strategy and inform that innovation that really gets us where we need to be to invest in those strong relationships and guide our food assistance response. We're going to focus on addressing the conditions that make food access inconsistent, those barriers that we talked about at the beginning, the structural barriers within the communities that mean that the neighbor up the street doesn't have a grocery store where they can visit. So just ensuring that people with lived experience, that their voice is at the center of everything, like we talked about, because we can't shape the programs and the innovative approaches without knowing exactly what the experience of the person who's facing hunger is and what those needs are, developing solutions with the communities that we're serving and not for them. So I think the bottom line for me is that in so many ways, the next generation is not going to be all about the new. It's going to roll the new into what's already working. It's going to be doing the right things together and doing them well and better where we should, and creating a more connected, community-driven approach so that we can build that resilience and stability for the people that we're serving.
Awesome. No, that was really well said. I mean, the idea that I think as we go forward, that we really need to understand what's needed on the ground and then work together to amplify that impact. Understanding the data and building off of it is going to be, especially as we move into an AI world, that should be much, much easier to get and synthesize that information. And Becca, I think especially with a lot of the work that you're doing on the education side, I guess, I mean, you guys are doing fantastic work to educate people in the choices and, how they move forward in their lives to break them out of this cycle of poverty. How do we make that a nationwide initiative? How do we expand that or amplify that across the world, to uplift everyone?
It's not an easy process, and we've had organizations and food banks call us. It's not our innovation. It actually comes from the AHA process, and it's from Ribby Payne first wrote about folks in poverty, and she wrote her book to help teachers understand how to teach students who came from poverty, so that so teachers could understand why their students were falling asleep, why their students were just had different issues than some of the other students of students that were in poverty. And so this particular curriculum, Getting Ahead and Just Getting By World, is written by Phil DeVol, and from that same company, AHA process. And there are there's a movement of folks that are trying to do this across the country, but there are other of these kinds of programs that can work. It's just we have to all be convinced, I think, that that's important, because it's easy as a charitable food network to pack up boxes of bags and hand them out. It's easy with volunteers to do that. It's easy, and not putting any thought into what we're doing for folks is sometimes, in some instances, keeping people stuck. So we have to acknowledge that we're helping and we're contributing to keeping people stuck, so that we can make a change. I am a huge choice-centered, dignity-driven access advocate. And, there are several Feeding America food banks in Indiana who have community marketplaces that look very much like grocery stores. And that is so much better a model. It helps them find food that is culturally preferent, has cultural preferences, dietary needs, family routines. Helps restore agency, and people can get the food that they need, and rather than passively receive aid. And it helps improve nutrition and builds trust. And so in that instance, this switch, I think, is important, as we just kind of look at the change and see if there's a way that we can make things a little bit different for folks, and that helps our neighbors who are facing and experiencing food insecurity to be a part of solving it all. I can't tell you how many folks in those instances also ask, how can they volunteer? So to what Jada said, how can I also, I don't want to just take, I'd like to be a part of the solution. Let me see if I can help. So I think that's a big shift that we need to look at. It's not an us and them anymore. We're all together. We're all working on this together.
Awesome. I think that's actually probably the most inspiring thing, that, you know, that no one should be left alone, that we're all in this together to solve a problem that should never exist in the first place, given the resources that we have on this planet. So Scott, let me turn to you on the health stuff. So I mean, some of the stuff that you said that's happening in North Carolina is pretty fascinating. You know, a lot of the data-driven, you know, solutions to figure out where there's problems before they become even bigger problems. What's one health system insight that the hunger sector is not using but should? And then the second part of this question is, you know, given that you said that, you know, that it was the pilot program that you guys had started was saving $85 in Medicare costs, I think is what you had said. You know, how do we get the health system, the healthcare system, to push a lot of these initiatives towards solving hunger as well, nationwide?
Yeah. So I think, you know, to the latter part of your question, I think the policy did play a very significant role from, you know, enabling a program like the Healthy Opportunities Pilot, you know, also involved in the Affordable Care Act, where there was a provisional timeline of, you know, voluntary suggestions that health systems be screening for these needs, and then soon to be, you know, some requirements to participate in programs. And that is a helpful thing, I think, from the perspective of a community-based organization to, you know, have hospital systems sort of brought to the table in that way. And I think similarly, outside of federal policy, the Joint Commissions, which is a body that you know, accreditates hospital systems, similarly has had those screening requirements kind of indicated as something that hospitals should be aware of and preparing for. Um, I think some of those requirements have been rescinded. Duke has decided to continue making the effort and building on the experience and the work that we've been doing in the community. And um, I think, you know, across, I think to get to the point that we have as a health hospital and health system to do that screening, we've had to learn a lot from our community partners. And I think, uh, you know, any advice that I would give is just to look to your healthcare partners and you know, try to make those inroads and connections and partnerships. And I think a great way to make that first step is to you know, find ways to talk to the people that work there and invite them to come and see the work that you're doing. You know, these are humans as well. And you know, running our own food pantry from within the hospital system, we've had families come and you know, physicians and their workers and research teams have been able to come and work with us and share and see each other in new lights. I think leave that work invigorated and also interested in returning to that work. You know, maybe again to pack a bag, maybe, you know, in their more professional capacity. And so I think just underscoring that relationship building, because I think, you know, building folks who are passionate about this work, I think is what's really going to help us continue to generate new ideas. And you know, I've seen it. You know, it's how we help inspire and create that next generation of folks that are going to continue the work and solve the problems that we couldn't. Um, and I forget the first question.
The first question was, what's one health system insight that
Oh, I
that we're
did.
not
Okay.
using that we should? Yeah.
Yeah. No. Yeah. Yeah. I think, you know, getting to know the people that work there, and you know, I think it from a healthcare perspective, you know, what we're learning from our community partners is, yeah, just how much work goes into this. And, you know, we have invested in technologies that have helped make it easier for us to screen for these needs and share about those needs. And then we don't really see any outcome from that. And because it's not enough to just like present the problem or make connections. It's certainly a huge part of it, but you know, I work in a position of helping oversee this food pantry, but also I am paid to go and leave Duke and go in and spend time with our community partners and see how are they doing, you know, and I think hospital systems should invest in that role and really find ways to put, you know, get some skin in the game in terms of understanding what the day-to-day work is like of their community partners and social service partners. So I'll leave it at that.
Awesome. Thank you. Stevens, I'm going to give you the last word, but Sakina, as we kind of talk through what this perfect world looks like and where we're kind of going and what's needed, what's one federal action that you believe would reduce hunger on a national scale? Very
Well,
brief.
I think an important thing at this stage is just to reverse course on a lot of what happened with the One Big Beautiful Bill Act that was passed in July that cut SNAP, I think, to the tune of $187 billion. Some of that has not been realized yet, but when it does hit states, they won't be able to absorb a lot of those costs, and a lot of people are already feeling that. So I would reverse course on that. If I was not speaking to the immediate moment, I'm really a fan of universal basic income programs and the federal government. We saw some of that during the COVID-19 pandemic when people received stimulus payments. If they had a particular level of income. The work of the Magnolia Mothers Trust in Jackson, Mississippi is really, really remarkable. They work with single Black mothers in particular and give them a baseline of income every month. And the data that comes out from that reveals top spending is on food, car assistance, paying for school supplies, paying off debt, paying for medical care. People need money to be able to take care of themselves and their livelihoods. People living in middle income and high income households are typically not reporting high rates of food insecurity or standing in line at food banks unless it's typically an instance of a disaster that's occurred in that particular area. And maybe our colleagues from food banks can speak more eloquently about that. But people need more resources. They need more money for their livelihoods. And so any effort to be able to do that, guaranteed jobs, guaranteed income, the government is able to think creatively and act creatively on that. And I would want to see something of that nature to support people's livelihoods and their families.
Awesome. No, that's great. And Stephen, so last question for you, just to kind of summarize it. What does a truly hunger resilient U.S. community look like?
I would say shortly that it's a community that relies on a great diversity of food sources, and so that was to be short. But before coming back to the question, I would like to mention just to make sure that it won't be said that it was a blind spot of our discussion, that we still need to do more to reduce food waste in the US. And it's part of the moral failure you were talking about, because we cannot be wasting so much food while so many people are hungry. And I'm sure that there are already many initiatives regarding this. To get back to the idea of being resilient, this is resilient is also a buzzword, and especially in the social sciences, and because it can be used loosely to mean all kinds of things, and also avoid some actors from playing the roles. Let's say since communities are resilient, no need for federal actors or state actors to do their job in really solving this issue. So, but it's still an important thing, especially you can feel that in moments of crisis like the pandemic, how it can make a difference being resilient or not. One thing about resilient is also that most people think about it in terms of bouncing back after the crisis, but food systems researchers note that it's also about absorbing the shock at the beginning so that if you could even not feel anything at the beginning, it would be what a really resilient food systems look like. But if you have to feel it, you can absorb some of the consequences so that people are less affected. And also, most importantly, this is one overlooked aspect of resilient. After the shock, you need to still think about how we could transform and learn from what has happened so that for the next crisis, we don't experience the same thing. And to present one simple action we could communities that may not work everywhere, but I think in mostly rural areas, this is one simple action that can be done. And I'm referring to one thing my lab has been working on, which is the idea of home and wild food procurement that includes not only gardening, but also foraging, hunting, fishing, or raising backyard animals for food. And these are activities we have found, for example, that food insecure households are more likely to engage in these activities than food secure households. And also that over time, engaging in these activities can even improve food security, which is quite interesting. And it is also associated with better dietary quality. But even if these people are like, want to be self-reliant, that doesn't mean that they don't face barriers in engaging in these activities. Or, for example, you need land if you need to garden. And it takes time, you need skills, you may not know where to start, how to start. So removing these barriers could be an easy step. I don't think that costs too much. Sometimes just sharing the information can really be a good place to start. And so removing these barriers may be a simple way also to make these options more accessible to people and improving access. So I think that home and wild food procurement can be an interesting lever because it has been overlooked when we talk about food security interventions or food systems, but you would be surprised how it can be common in some rural areas, and it helps people cope with difficult times. So we need more research on that as well, because many of the claims are still associational. We need to be sure that it's not because, you know, people are already food insecure that they engage in these activities, avoid reverse causality claims. But still, I think there is enough evidence that this can be an interesting policy lever to improve food security.
And I think the food banks, actually, the work that Jada, Becca, and Cindy are doing, I mean, that's a great place to actually both what Scott talked about and Stevens, you know, working closely with food banks where they can implement a lot of these solutions much faster than maybe anything at the federal level could, is pretty awesome. So, you know, before I turn it over to Madhavji, I will just say that the book I mentioned in the very beginning, The Other America by Michael Harrington, this was a book written in the 1960s, and he basically said that when people moved from the rural areas to urban areas, poverty became invisible, right? Because you see people who were in houses just like yours, drive cars just like you, that live lifestyles just like you. And so I think it's really nice to see that, you know, the question is not just, are we going to solve this problem? The question is, are we willing to see the problem? And I think that is definitely changing. And so I really welcome today's discussion, and hopefully this is just the beginning of a much longer conversation. Yeah, Stevens?
Sorry, I would like to add a last point. I think at the federal level, we need to keep monitoring food security. It's an important thing. We need to have the data. Unfortunately, in the US, we use the household food security module to track food security every year. But it was announced that they may stop publishing this data. And so we are going to be in the dark about who and who is food insecure and how food insecurity rates are evolving. This is really a sensitive issue.
I think you had mentioned that to me when I'd spoken to you on the phone, that France had stopped like 5 years ago, and so they're under this, maybe then you start becoming disillusioned that maybe the problem is not there anymore because we don't have the data to show that it's still a problem. And that would be a huge injustice to the people that are suffering. And so, yeah, thank you for mentioning that, Stevens. Madhaji, I'll turn it back to you.
Thank you very much, Rakiji, and thank you to all our panelists. Such an engaging discussion. It could have gone on for another hour, and personally, I learned so much today about things that I'm not aware of. I think the beauty of the conversation has been it's operating at the intersection of policy making, boots on the ground nonprofit activity, and combining that with academic research, right? Bringing all these three together and looking at not just the hustle of providing emergency assistance today, but the thoughtfulness of building sustainable solutions and really bringing the blend of both together. Honestly, I learned a lot. There are a few things that stood out to me, or a few things that I learned is one is hunger and food insecurity is not a single cause problem. It's a multi-pronged problem. And to come up with sustainable solutions, whether it is addiction treatment, whether it is providing them with building better livelihoods, or the skills trainings, etc., do play a role there. The second thing that really appealed to me is how thoughtful you all are. The word dignity was called out so many times, whether it is putting produce in a very inconspicuous or discrete bags, for example, discrete packaging and things like that, or providing playgrounds at food banks for children. These are it just shows that the professionals like you who are engaged in doing this kind of activity are being very thoughtful on how to bring those that are having these lived experiences to the center of the design of the experience, but also in terms of engaging them and designing the solutions. The other thing is, I got a PhD in chemical engineering, so I was geeking over in my mind about wastewater analysis and solutions like that, which is really bringing technology and advanced analytics to bear to get to the root cause of these problems. I also love the idea of food as medicine that several of you have brought up, really partnering with these healthcare communities, making sure that we are finding sustainable solutions, bringing food into the conversation and looking for signs of food insecurity. In relation to that, I also love the idea of, especially these teachers who came from poverty, for them to catch these signs within the children and engaging educators in the process too. I thought that was absolutely brilliant. The supply chain professional in me was geeking out when I was hearing about stabilizing demand and supply for food banks. I think a couple of points that was brought up in that context is one is reducing food wastage. Wastage saved is actually food given to somebody and having made it accessible. So I thought that was brilliant. And also this idea of, even it's not just access to grocery stores, but also what assortment is carried in the grocery stores is equally important. Recently, I was reading about this Azalea Fresh Market they opened in Atlanta downtown. I couldn't believe it when I learned that Atlanta downtown really did not have grocery stores, right? Like we see in the suburban Atlanta. So I think innovations like that, federally funded programs, I think go a long way in tackling those kind of problems. And also some of these sustainable solutions. One thing I also heard about is the importance of partnerships, whether these are partnerships with the nonprofit organizations, whether these are partnerships with federal programs and the local programs, etc. I think it's very, very encouraging to hear that, because these are the types of problems that one organization cannot solve. So partnerships do play a role, and appreciate you all participating in that conversation. Last but not the least, strengthening the policy making. What happens at the federal level has got implications on last mile delivery. That was loud and clear as well in today's conversation. But hopefully we can, through these collaborative programs and partnerships, we have the ability to even influence the policy making as well. So really, really appreciate all of you taking part in today's conversation, and look forward to more. This is just the beginning of the conversation, right? Not the end of the conversation. Look forward to a lot more engagement. Thank you, thank you, thank you once again. So with that, Rakiji, you want to say something, or
No, I think Linda's raised her hand. I think she has a
Oh, sure,
question.
sure.
Oh,
Sure, Linda, go ahead. Linda, I think you're muted.
Yeah, I'm sorry, I'm trying to unmute. So what I just wanted to mention is that long ago, I worked with an organization called Results, and they are an advocacy group on hunger and poverty, and they have the most robust model for advocacy I've ever seen. And I keep hearing you talk about the policy problems that you're having, and I think that one, using their method, which was incredibly innovative, where they would train volunteers within their area. They would get a kind of like Sewa works, where they would get a group of people together in each area, and they would work on a common initiative over the entire span. They would try to get nationwide, and they would train people how to do things like give 1 minute speeches, so that you could educate people that you were talking to that were that were policy makers. And one other suggestion that I have is a concept called speaking truth to power. So if you're in a situation where you're trying to influence the policy makers, if you can say, well, you're saying that, working for I'm sorry, I don't want to name any names, but if you want to say, let's make America great, what made America great was that we had farmers, and the farmers created a situation where the money was in the hands of all of the people, because when a farmer had ability to have resources and employ others. And so if we were to say, you want to make America great, let's look at how can we connect the farmers, the local food systems. If you're giving away the jobs to people in other nations, let's make the policy that our local farmers are being helped by helping the problem of the food insecurity. And when you do something like that, where you're speaking truth to power, you sort of put people on the hot seat where they have to respond appropriately. And it's just a good tactic. So those are just two things that I wanted to mention that have been part of my life and mean a lot to me.
thank you so much, Linda. We appreciate it.
Yeah, thank you very much. So just in terms of closing, these policy cafes are a way to stimulate these conversations and drive action in the community. So we did hold policy cafes, and we have upcoming policy cafes as well, focused on education, disaster management, nonprofit management, etc., in the coming months. So hope to see you all for future conversations as well. And Sewa, from a Sewa perspective, we are looking to build these long-term partnerships with experts like yourself, people like you do boots on the ground work. So so that we can drive action, like I said before. So look forward to more collaborations in future. And also from today's conversation, we'll be sharing some of the key takeaways and stories from today's discussion. So stay tuned to our newsletters and Seva International's communication channels. Once again, thank you all for joining us today. Thank you for spending your valuable time with us. And we look forward to continuing to learn with you and build together a world where we can bring these communities together and really feel empowered to tackle food insecurity challenges in the society that we experience today. Thank you for not just bringing the problems, but bringing in valuable solutions and experiences too. Thank you very much.